On to our first presenter, Dr. Gauri Divan. The topic is addressing the needs of families of young children with autism in low resource settings. Dr. Gauri Divan is a development pediatrician and the director of the Child Development Group at Sangath, an NGO based in India with hubs in Delhi and Bhopal. She has been part of the technical resource groups of the Rashtriya Bal Swasthya Karykram, Government of India, and on the WHO Technical Consultative Group, providing expertise for autistic people in developing countries, for services for autistic people in developing countries. Dr. Divan has been a member of the Lancet Commission on the Future of Care and Research in Autism from 2019 to 2021 and is an INSAR Global Senior Leader. She has been teaching in Sangath's Leadership in Mental Health course since 2009 and has taught case studies in global mental health delivery at Harvard Medical School. She was also visiting faculty at the University of Ibadan Master of Child and Adolescent Mental Health Program.
So thank you very much to IFRA and IDF for this invitation to speak to this audience. And as described, and thank you also for the kind introduction, I'm going to talk about an approach that we've taken to address the needs of families of young children with autism in low resource settings. So a little bit about us and the organization I work with. I work in an organization called Sangath. It's an Indian not governmental organization or a not-for-profit, which was established in 1996. And the aim is really at generating public health research, which can help transform mental health across the life course. We focus on psychosocial approaches, and a key aspect of our work is recognizing the lack of specialist providers and providing innovative approaches and solutions to fill this gap. Venki has already spoken about autism spectrum disorder, but I'm just going to go over a few more points. One is that we know it's a neurodevelopmental disorder, but what I want to talk about is a key impairment that, yes, the interaction with environment is very important, but a key impairment is also social communication, which is one of its fundamental difficulties that children with autism have. It is present from birth, but these impairments are often recognized as the child grows and is most often diagnosed by the age of 4 years old. There are gender differences in presentation, and we seem to be recognizing autism much more frequently in boys. And there is now some interesting research about whether girls and females present a little differently and we're not picking them up adequately. Children with autism, as already described, have varied levels of care and often require substantial lifelong help because of the impact which lasts through their lives. Also, just to say in terms of prevalence, autism impacts 1 in every 100 children. So though it's not a common disorder, it's also not very rare. It is present in our communities, and we're increasingly recognizing it in the field. This slide really talks to the journey that Sangath has taken with respect to the research we've been doing in autism in developing these innovative solutions. As I already described, we started off as a child development clinic in 1996. But in 2009, we decided that instead of focusing on service delivery that many organizations were focused on, we would really start understanding and exploring the experiences of families and doing fundamental research in trying to understand what do families need, what are the gaps, how can we support these gaps. And so in 2009, we really drilled down through the Aarti project on exploring family experiences. And one of the highlights of our findings was that families really didn't know where to go for interventions, but also they didn't know what intervention to go for. There were very few evidence-based interventions. And so between 2012 and 2016, we set up to adapt an intervention that I'm going to talk a little bit more about, which we call PASS Plus. And we evaluated this through what we call randomized controlled trials in 2 settings in India, once in Goa in a peri-urban setting and then in rural Maharashtra. In 2018, we got funded to evaluate it using a frontline worker. So really thinking about, instead of using project-based workers, who is the worker that exists in the health system? And can we train up these workers to deliver this intervention? So in India, we have a frontline worker called the Accredited Social Health Activist, or the ASHA. And we trained 11 of them, and 7 of them delivered this intervention in a randomized controlled trial, which is still underway and will be completed this year. On the back of the research that we have done for 20 years really in the field, we've received a very ambitious project grant, which is called Namaste, where we are going to be working in 3 countries in 4 districts in South Asia to develop and implement a detection care pathway. Can we detect children in the community early using existing workers? And can we deliver these interventions in a rollout through 4 districts, 1 in Nepal, 1 in Sri Lanka, and 2 districts in India. I also, I won't go back to the slide, but I want to mention before I start on this slide that we have a number of international foundations that have been giving us support for the research we do, which includes Autism Speaks from the USA, Grand Challenges Canada, and we get MRC UK as well as NIHR money for the current work that we're doing. So the intervention that we've been focused on is parent-mediated. And I'm going to try and explain what this means. So unlike most therapies where a counselor or a therapist works directly with the child, we actually don't work with the child at all. We work only with the parent. And the intervention, in this intervention, the parent receives the support to adopt strategies which support their child's specific needs. Parent-mediated interventions can be delivered in the child's natural environment. They can be tailored to the individual parent and their child. Because the parent learns these strategies themselves, they learn to generalize them quite quickly. So, for example, parents may be taught in a counseling session how to do the strategies, but then they also do these strategies at feeding time, at bath time, at bedtime. So these skills get generalized very quickly into the life and the environment of the child. The parents can respond to new problems with their acquired skills because we're handing the skills over to them. And there are more opportunities for full family participation. For some reason, okay. So this is the intervention that we've adapted and developed. It's called the Parent-Mediated Autism Social Communication Intervention for Non-Specialists Plus, or PAS Plus. It is adapted from the Preschool Autism Communication Therapy, or PACT, which was developed at the University of Manchester in the UK. It's a developmental approach, so it's not behavioral. It thinks about the typical trajectory of social communication development. It recognizes the neurodiverse ways that children with autism communicate, and it tries to put the children back on track by teaching parents how to create the social communication supportive environment. It's modular in its approach. It has been developed for non-specialist delivery. So unlike the PACT, which was delivered in the UK by speech and language therapists, we don't have enough of them. So we've actually delivered it through a non-specialist trained workers. It uses video feedback, and you're going to see this in a little bit. And it's delivered in a naturalistic setting, either at the center or at home. This is a little video of what a typical PAS communication session looks like.
हाँ, तो बताएं कैसे हैं आप?
मैम मैं ठीक हूँ।
तो क्या आप मुझे ये बता सकते हैं जो पिछले 15 दिन में जो हमने तरकीबें की थी उनका अभ्यास कैसे कर पाए जो पिछले सेशन में हमने किया था?
जी, ये 15 दिन अच्छे रहे और मैं ज्यादातर दिनों में प्रैक्टिस कर पाई हूँ।
वाकई में ये जान के मुझे बहुत अच्छा लगा। क्या आप मुझे याद दिला सकते हैं कि हमने कौन से लक्ष्य बनाए थे?
हाँ, यही कि अनायरा को उसकी इंटरेस्ट के हिसाब से खेलने की परमिशन दूँ और मुझे उसके साथ खेल में अपनी खुशी को शेयर करना था।
क्या आप बता सकते हैं कि आपने कैसे किया?
हाँ, मैंने कल उसके सामने कुछ खिलौने रखे जिसमें एक ज़ाइलोफ़ोन और एक ड्रम रखा। उसने ड्रम को चूज़ किया अपने खेलने के लिए।
ये तो बहुत अच्छी बात है। मैं आज फिर से ड्रम लेके आई हूँ और एक ज़ाइलोफ़ोन है, 2 स्टिक हैं और किचन सेट है। एक स्टिक आपके लिए है, एक अनायरा की। चलिए प्ले रिकॉर्ड करते हैं और इसमें आप पुराने लक्ष्य को ध्यान रखते हुए खेल का आनंद लें। तो आज का खेल कैसा लगा आपको?
मुझे बहुत पसंद आया। मैंने महसूस किया कि अनायरा ने और दिन के अकॉर्डिंग ड्रम को ज़्यादा देर तक बजाया है।
जब हमने इसको एक साथ देखा तो क्या खेल की वीडियो में कभी ऐसा लगा कि आप दोनों खेल का आनंद ले रहे हैं?
हाँ, मुझे अच्छा लगा था जब हम ड्रम बजा रहे थे और उसने भी मेरी तरफ देखा और स्माइल दी थी।
हाँ, मैंने भी इसे गौर किया। चलो फिर से देखते हैं। उस क्लिप में जो कुछ हो रहा है उसका ये एक अच्छा विवरण है। आइए चलिए एक दूसरी क्लिप देखते हैं और आप मुझे उसका वर्णन दें कि वहाँ पे क्या हो रहा है। आज हमने देखा अनाया ने ड्रम उठाया, आपने उसे थोड़ी देर के लिए उसके तरीके से खेलने दिया और फिर उसके साथ खेल में जुड़ गए। उसने भी खेल को खुश होकर खेला और ऊपर देखा, आपको देखकर मुस्कुराई, लेकिन जब आपने खेल की गति बढ़ाई तो वो दूर हो गई। तो जो अगले 15 दिन के लिए हमें लक्ष्य बनाए, आप मुझे बताएंगे?
जी हाँ, हम ऐसा कर सकते हैं कि अनायरा को उसके इंटरेस्ट के अकॉर्डिंग उसे खिलौने चूज करने दे सकते हैं।
हाँ।
और जैसा वो खेलना चाहती है उसके साथ वैसे ही खेल सकते हैं।
बिल्कुल, बहुत अच्छे से आपने बताया और मैंने वही लिख दिया है। ठीक।
So as you noticed in that video, it's based on video feedback. We get parents to look at themselves playing with their child. And based on manualized strategies, the counselor gives advice to the parent and gets them to recognize what they're doing well and what they could do differently to support their child. I'm going to show you now a video about these frontline workers because there's a lot of skepticism about whether we can really train up these workers to deliver a complex intervention. And here, let's listen to a few of them speak.
एक आशा कार्यकर्ता होने के बावजूद ऐसे बच्चों को ध्यान नहीं दे पाते थे जो कैंपस में आने के बाद हमारे लिए संभव हो पाया है। हम उनके लिए भी काम कर सकते हैं। अच्छी बात यह है कि ये इंटरवेंशन घर पर दिया जाता है, खेल के द्वारा और मुफ्त में, जो कि परिवारों को अच्छा लगता है।
यहाँ पर मैं ऐसे बच्चों के साथ काम कर रही थी जिनको ऑटिज्म था। तो ऑटिज्म के बारे में इससे पहले मुझे कुछ पता नहीं था और स्टार्टिंग में जब हमारी ट्रेनिंग हुई तो हमें पता चला कि किस तरह से हमें जाके सेशन डिलीवर करने हैं। और जैसे कि एक उपचार होता है उसमें मेडिसिन देते हैं, तो वो मेडिसिन दी जाती है पेशेंट्स को। तो पेशेंट जब दवाइयाँ खाता है तो हम उसका देखते हैं कि इसको असर कर रही है या नहीं कर रही है। बट इस उपचार में बिल्कुल अलग था। हमें ये उपचार देना था उनके पेरेंट्स को, मतलब जो उनके केयर टेकर थे, और हमें डायरेक्ट बच्चे के साथ इसमें बात नहीं करनी थी, ना उनको हमें कोई जाके सीधा कुछ बोलना था। हमें बस पेरेंट्स से बात करनी थी। और इस अगर हम देखें इस जो ये ऑटिज्म का जो उपचार था, इसका मेन मोटिव था बच्चे और माँ के बीच में जो बॉन्ड है वो स्ट्रॉन्ग करने का।
शुरू में हमें भी लगा था कि पता नहीं ये इससे क्या होगा, कुछ इस उपचार को देने से आगे कुछ मतलब लोगों को कुछ बेहतरी अपने बच्चों में दिखाई देगी, नहीं दिखाई देगी, बट ये बिल्कुल अमेजिंग था। मतलब इतना सुधार देखा, जिन बच्चों को मतलब जो वर्बल भी नहीं थे उन्होंने भी कुछ स्टेज पे आके कुछ आवाजें निकाली, कुछ हल्के शब्द बोलने शुरू किए, कुछ एक्टिविटी शुरू की, और जो मेन हमारा ये था कि कम्युनिकेशन जो एक था कि बच्चा सोशल कम्युनिकेशन से जुड़ पाए, वो जो चीज थी वो सच में इसमें दिखाई देती है कि बच्चा किस तरीके से कनेक्ट कर पाता है चीजों को।
So basically, what we are trying to do is really improve shared attention in the context of the parent and the child. So our work is really with the adult. And what we do is we encourage the parents to adopt very simple strategies, to observe their child carefully, to identify their child's signals. So what are these signals? Because these often communication signals in autism are quite weak. We get parents to become better observers of their child's signals, to follow their child's lead in play, particularly, and then later on generalize to the real world and daily routines, and then to engage in their child's activity. So to validate to the child that what you're doing is interesting. I, as a parent, am interested in what you're interested in. Let's play together. So here is, just simple examples of the way we work. These are some of the strategies we work with.
Dr. Gauri, you have a couple of minutes.
Yeah, I'm on my last slides. Yeah. So really, this is the way we work, which is, if a child is playing with a car, we get the parent to play with the car in the way the child is playing with the car. So observe and copy, and then copy and expand. So play with the car and maybe then say car. So the child starts associating these words. And in a similar way, we get the parents to encourage them to use everyday opportunities to do very much the same. So if a child wants water, the parent notices this, because often the child's signals are quite weak. The parent will pick up a glass and say water and give the water to the child. So we're trying to help the child and validate the child's ability to socially communicate with their caregivers. So really, this is my last slide. Helping parents succeed is really our aim, to understand parents' views and expectations, to explain to parents how intervention supports social communication difficulties and autism, to adapt the intervention to fit the family, to focus on the key challenges that families feel are important. So this is really our aim, is to put the family and the parent first. In sessions, we start small. We help parents focus on stepped goals. We help parents problem solve when progress is slow. And we help parents identify times when they can practice new skills. So that's really my presentation. It's still, watch this space, because our main randomized control trial, the results will be really available only at the end of this year. Thank you very much.